There are some questions regarding the thick skin rhinoplasty patients. So frequently people ask me what are the differences between thick and thin skin patients for rhinoplasty in terms of result, outcome, and also they're asking why thick skin rhinoplasty is harder. Mainly three differences we can see for thick skin patients. These three differences: first, redraping of the skin, because thick skin, it creates a thicker coverage, so we make some changes inside the nose with the skeleton bones and the cartilage, a little bit thinner tissues than the bones, but they are elastic. In the tip of the nose, we have a lot of cartilage. We fold them, we stitch them, we lift them, we give some shape. Upper part of the nose, usually we have nasal bones. So when you do some changes in this skeleton part, our dress, skin, must redrape over it and take its shape. With thick skin patients, this redraping, this taking shape time is slower because thick skin redrapes slower. With thinner skin, it drapes faster over the nasal skeleton and it takes shorter time, of course. And the second thing is skin thickness itself. Skin covers that tissues underlying the skin and this nasal bone and cartilage part. So when you have a thin skin, you see more about the bone and cartilage. A person who needs or wants definition on the thick part or the nasal bone part, when this thick skin covers it physically, it shows less. So what can you do? You can make skin thinner by taking out some fat, if there is some fat under the skin, and or you need to put some harder or stiffer material to show this definition. We usually use extra cartilage for that. This can be ear cartilage, rib cartilage. And this material, when you put here, you see more definition, because with time, these stiff materials, stiff cartilage, are pushing the thick skin and it makes it thinner. Like we see in, for example, in breast augmentation surgery, the breast implant push the envelope and 3-4 years later, you see the skin is thinner in that area. It's the same principle. And sometimes, especially in Asian countries, they use implants for augmentation, for definition purposes. You can clearly see this makes too much pressure on the skin, which makes skin very tiny. So this material that we use in thick skin patients, it must be strong enough to give definition, but not very hard to cause a problem, and it must be a natural material. The third thing is skin texture. Not every time, but usually we see our thick skin patients, they have oily skin. So the skin texture can be a problem. Before the surgery or after the surgery, we recommend to use some skincare products or medications for this extra oil part, like acne medication. This might be different for each person, and the time can be different for each person to use it. Also, this helps, this redraping after surgery, make the skin a little bit thinner. Also, it has some anti-inflammatory effects. So, of course, surgery creates some swelling, and after surgery, our skin produces more sebaceous products, more oily products. So it's good to dry it. That's the difference between thick and thin skin patients. Of course, with thick skin, we need these materials, extra care. It takes a little bit time and it can be difficult, but also thin skin can be a problem because it shows everything so much. With my practice, I do rhinoplasty. Most of my patients have thick skin and oily skin, and we use these techniques to improve surgical outcome. The importance of skin type between these differences are important, but the importance of skin type is mostly about patient expectation. If you expect very tiny nose result for the tip part, and this might not be a realistic expectation for you. And of course, with experience about this field, this surgery, we use all this kind of techniques, scientifically proven techniques, to improve our surgical results. And of course, in surgery, it needs a little bit dedication, surgery time is a little bit more, and aftercare, it takes a little bit more time for healing. I tell my patients before 4 months, 6 months, don't expect anything. Usually when I see my patients after 1 or 2 years and I see them like 4 years later, I can see that tip part is getting smaller. But those are not the only factors that give our results. Also, diet, especially first few months after surgery, an anti-inflammatory diet is very important. And also, gaining or losing weight, determining the outcome. Sometimes when I show my patients before and after, I can see like really unbelievable changes. And most of the time, they start to eat and drink more healthy. And also, they lose some weight, like 20 kilos, 25 kilos. They lose some weight, and also you can see they have more definition for the nasal tip. All these work with surgical techniques, lifestyle changes, and some aftercare is going to give you the ideal results if you have a thick skin patient.